I died 3 times. 25 minutes worth of CPR. I didn't know what was going on. I didn't feel a thing. When I woke up, I was in hospital and the nurse told me, "You had a heart attack." I was in disbelief. I was like, no, no, I didn't. I'm Krissy Lee and Braggaman, born and raised in Chinchilla.
Toowoomba local, always have been. A roofer by trade. Started work out at Chinchilla, and that's how I met Krissy Lee. She was a cleaner at the place we were working on. We sort of kicked it off there, and she ended up pregnant, so we ended up back here.
And we've been here ever since.
That night, it's about 3 o'clock in the morning. I actually had a bit of an injury myself. I had a sore calf from work, and I was out here sleeping in the lounge room. I remember waking up and hearing Krissy sound like she was choking, gargling. I got up pretty much straight away, went into the bedroom and found Krissy all twisted and lying crossways on the bed. Bit of shock, never seen you in that way at all before.
And then, yeah, I guess the worst happened then. I was actually in Chinchilla visiting my sister. So I've been out there for a few days and just with the kids, and we were all worn out. Came all the way back home, sorted the kids out, dinner, showers, all that jazz. Back then I was still smoking, so I was sitting there at the table smoking. I remember going to bed myself around 2, I think it was. That's all I can recall from the night that it happened.
I remember hearing the gargle, and that got me concerned. I also noticed too that you had no pulse, and that's sort of when I had that instinct, grabbed my phone straight away, called 000. The lady on the phone asked me the questions.
Is she breathing normally?
Does she have a pulse? I'm like, no. And she goes, okay, you're gonna have to drop her onto the floor and start CPR. So it was, very confronting and very scary. As soon as the paramedics rocked up, they were brilliant.
30 years of age, reported unconscious and not breathing. Patient filled with
The job was coded as a 1 alpha.
responding units proceed with life sensors.
I'd arrived shortly after resuscitation had commenced to see a 30-year-old lady and her partner and a couple of kids at scene. The patient was in fact in cardiac arrest. 10-15 minutes was spent at scene trying to address what's the probable and most likely reversible cause for this cardiac arrest. We could quite clearly see that her ECG pattern was showing gross signs of elevations. Typically what it represents is a block in one of the coronary arteries, so one of the arteries that supplies the heart muscle oxygenated blood, and subsequently be able to beat and pump. We suspected, by logical deduction, that was the primary cause of Krissy Lee's cardiac arrest.
I got a call from the ambulance service in the morning around 4:30. They have a young lady with a cardiac arrest and they are doing resuscitation.
Krissy Lee was collected from home by Queensland Ambulance Service and then brought directly to St Andrews under lights and sirens. The paramedic team notifies the hospital and the cardiologist. The nursing staff team managers are notified for the coordination of the cath lab staff team, intensive care team, and any other ancillary staff that need to be coordinated to be brought in for that case.
Krissy Lee had a cardiac arrest from a condition called myocardial infarction. It's a condition where the arteries of the heart get blocked off with a blood clot and the heart muscle is not getting blood. So we need to open up the artery as early as possible.
We like to say it's a 90-minute window from the time the ambulance is called to the time on the bed, and that's when damages to the heart muscle is irreversible. Before this STEMI service, they might have had to actually drive down to Brisbane, and that's 2-hour drive.
Had she have been maybe half an hour, 40 minutes away. There may be a different phone call.
Having this service here in Toowoomba, it's a better outcome for the patient the quicker we can get them to cath lab.
We did a quick scan to look at the brain to make sure there is no brain bleed. Did a CT scan of the chest to make sure there is no blood clot. Probably within another half an hour, we took her to the cath lab. So cath lab is a place where we put a catheter through the wrist or through the groin, put a stent and unblock the artery. We took her back to the ICU and the ICU team took over.
Krissy Lee was brought back to intensive care. She was intubated and ventilated, whereby that means she has a breathing tube in her mouth. She has been rendered unconscious by medication, keeping her sedated and pain-free. The whole point of intensive care is to support and maintain her vital signs so that her body's able to recover from the emergency acute incident of her heart attack.
Yeah, I just remember the other doctor coming out and letting me know that Krissy has been put into a
Induced coma.
induced coma, yeah, so sort of gave me the warning signs there and then, you know, they're checking on her. Just be prepared for anything, you know, bad.
Toowoomba is a town in the Darling Downs region. We are situated an hour and a half inland of Brisbane. Predominantly, I would say, have an ageing population. Accordingly, diseases of ageing, such as cardiovascular disease, is quite common.
We get patients through from out west, Roma, Dalby. Usually with these interventions they would have to travel to Brisbane. They don't have to do that now, even though they might still have to travel to Toowoomba. It's still not as far as Brisbane.
The hospital has facility to accept emergency patients for heart procedures like stent placement around the clock.
Emergency Heart Centre is a point of access to the hospital. It is a level 3 emergency department where we see all cardiac patients. It gives you access directly to a doctor who will then refer you on to a cardiologist if need be.
The service that St Andrew's Hospital provides is crucial for all people that come to St Andrew's or to the Toowoomba Base Hospital because of the 24-hour service.
You can either come in here via QAS or you can walk straight in and be seen.
Be they old or young as Krissy Lee was, it provides that care which is consistent and it's readily available.
I don't know any other emergency unit like this in Australia at all.
If somebody gets a chest pain, they need to call the ambulance as soon as possible. Time is very precious, even if the chest pain is mild in intensity. As the time goes, more and more heart muscle dies off without getting blood. So it is important to open the artery as early as possible. So in Krissy Lee's case, if this type of services did not exist in Toowoomba, she would have met with a very fatal outcome.
It was she's either going to be brain dead or brain damaged.
I might live, I might not. I might have another heart attack. Yeah, I know it was pretty fatal. I had everything hooked up to me. Got a few scars from where they sort of had to go up a main line to the heart and everything.
They had you on some sort of machine as well that cooled your body down.
We have a very helpful device called the Arctic Sun. This is an active cooling device. By cooling them, we're able to reduce their metabolic demand.
And of course we had other medications assisting her with her blood pressure. Other cares were attended by the nursing staff during that period of time.
You're out for 3 days, 3-4 days I think.
4 days.
4 days, yeah.
Woke up on the 4th day.
Shocked everybody.
First thing, I just thought I had a turn with my diabetes. That's all I thought. And then, yeah, the nurse told me, no, you had a heart attack.
So gradually her heart pumping improved, her general condition improved. She stayed in the hospital for a couple of weeks. eventually walked out of the hospital without any neurological or cardiac deficit, which was the excellent outcome.
St Andrews was awesome.
Yeah, I'm so glad they took me straight there. I wouldn't have been here at all if it wasn't for Josh and St Andrews. It just, wouldn't have been possible. They were beautiful, beautiful people.
Nurses, doctors, all of them.
They were amazing the whole way. They knew exactly what they were doing. They made you feel at home.
Made you feel like they cared.
Yeah.
St Andrews Hospital is unique in this treatment of patients with heart attack because we have got an excellent team. We have got 4 interventional cardiologists. We have got a team of well-trained cath lab nurses as well as ICU nurses who can manage this type of patients, and they are available round the clock.
There are other cath labs in Toowoomba, but they cannot do what our interventionalist cardiologists can do.
Our cath lab staff are rostered 24 hours a day, 7 days a week, 365 days a year, for the ability to provide care not only for our private paying patients, but also our patients in our public system.
Even if you do not have private health insurance, you can be taken into our facility, and this is a publicly funded initiative.
And I don't believe that's done anywhere else.
A very fortunate part of Krissy Lee's story is indeed that she received early CPR.
It starts well before me. It starts with the 000 call, her partner making that call, commencing CPR as instructed. It means that we increase the chance of survival.
So I was just walking up and down the corridor, just waiting to hear what was going to happen. Remember our doctor pats me on the back like that and he goes, "Good job."
And he actually did our CPR course just before it happened, so it was fresh for Josh. He knew what to do and he got straight to it.
Everyone was overjoyed that we were able to wake Krissy up out of her sleep, and when it's time for her to recover and she's able to speak and nurse her little baby, that in itself was overwhelmingly important for both medical and nursing staff to see that happen.
If I would have went that night, I would have not have woken up at all.
Heart disease doesn't necessarily discriminate. We're not just thinking about the elderly gentlemen in our lives. This can come for young females as well, unfortunately.
In Krissy Lee's condition, the precipitating or underlying risk factor was heavy smoking, which increased the chance of the blood getting clotted very fast in the arteries of the heart.
I never really looked after myself as well as I should have. I was very skinny, hardly ate, type 1 diabetic. It was a big wake-up call, massive wake-up call. I haven't had a cigarette, anything to smoke for nearly a year now. It was hard, but I knew I had to do it.
Made me quit too, so
Josh
because I was a smoker, but definitely changed my lifestyle. Definitely looking after myself now.
Yeah, the smoking left, the drinking all the time left. If I have a drink now, it's beer, low-carb beer, a couple of.
Especially with your diabetes too, you've gotten on top of your diabetes a lot more now.
I actually care for it. I've put on weight. Thank you so much.
Pass it on to my colleagues. She looks very healthy now. She tells a pretty amazing story, and she's making a very, very conscientious effort to improve her health for the better.
It's been a long road, but we're feeling better. We're kind of grateful for it.
Yeah.
Big blessing in disguise.
She's got 2 young kids, similar age to mine. Yeah, it's pretty special to know that they've got mum.
Yay.
Thank you.
That's what it's all about. Yeah, that's it. Yeah.
That's it. Got to wake up and see me babies.
Just knowing that it can happen to anyone. Definitely change our lifestyles. Eating healthier, exercising a bit more.
Yep.
For walks and everything like that. We usually go to the park every weekend with the kids and run around with them.
That's effort.
As much as we can. Thank you, St Andrews.
Yes, definitely.
Yes.
Brilliant doctors, brilliant staff, brilliant nurses,
Just comes down to good care. Good care, good hospital.
Amazing. Wouldn't be here without him. Yeah, hey, yeah, even he reckons.
Yeah.